I'm Dr. Katie Marks Cogan from Ask Dr. Katie, and today I'm going to be answering some of the questions you posted on Facebook and Instagram about early and sustained allergen introduction. Thanks to everyone who posted. The questions were great, and I picked a few of the most common. The first question is from Jamie B, and she asks, can't I just feed my baby real peanuts, eggs, and milk, and can't I do it myself? Great question, Jamie. This is one that I get often from my patients, and the answer is yes, you can do early and sustained allergen introduction yourself by giving baby foods with peanut, egg, and milk. However, because you have to wait until baby is mature enough to eat solids, this can be a challenge because many babies are not ready to eat solid food until at least 6 months of age, if not later. The landmark clinical trials on early and sustained allergen introduction actually suggests that it may be more beneficial to give baby allergenic foods closer to 4 months of age. In addition, it can be a time-consuming process because you can't just give these foods to your baby once and then forget about them. These same clinical studies also suggest that you have to give allergenic foods on a consistent and frequent basis in order to have the most benefit in terms of trying to reduce your child's risk of food allergies. I actually did early allergen introduction with my son when he was a baby, and it was difficult because I had to prepare all the food and I had to keep track of how often I was giving the allergens, and I also had to make sure that all of the food was getting into his mouth and not on his face or on his bib. So I do understand that it can be a frustrating process. And this is basically the main reason that my colleagues and I created Ready Set Food, because we wanted to make this process easier for families. Thank you for the question. The next question is from Annie B. She asks, my daughter has eczema, would you still recommend early allergen introduction? Thanks for the question, Annie. About 9 to 10 million children in the United States under the age of 18 have a specific form of eczema called atopic dermatitis. It's basically caused by a malfunction in the immune system and a problem with the skin barrier. Children with atopic dermatitis develop red, rashy, and itchy skin. We know that children with atopic dermatitis have a higher risk of developing food allergy, and recent landmark studies have shown that early and sustained allergen introduction is particularly important in this group of children. However, if your baby has severe eczema, then current national guidelines recommend that they receive allergy testing prior to the introduction of specific allergenic foods. So if you're unsure about the severity of your child's eczema, I recommend speaking to your pediatrician or your allergist to find out if early and sustained allergen introduction is right for you. The next question is from Ilani Z, and she asks, can't I just eat peanuts, egg, and milk while I'm pregnant or breastfeeding? Won't that reduce my baby's risk? Great question, Ilani, and one that I think a lot of moms wonder about. Currently, scientists do not believe that specific maternal diets during pregnancy or breastfeeding can be protective against food allergy, but this area is still being studied. So, current national guidelines still recommend that early and sustained allergen introduction be part of a baby's feeding routine regardless of mom's diet. I hope that answered the question. Thanks so much.